Me, Lupita.
I'll kind of go quick, respectful of your time, but please, I am here because of you. So if you have any questions, stop me at any point. We good? I don't see any thumbs up. I see one. Thank you, Karen. Gabby, thank you. Lupita. Okay, so we're good. I need 2 screens. I'm trying to find my share. Here it is. So lecture exam. Know the disease caused by vitamin D deficiency in adults. That would be osteomalacia because it's rickets in kids. Know which pigment in the skin absorbs ultraviolet light. That pigment is melanin, not melatonin, melanin. Know which exocrine gland is primarily used for thermoregulation. We have 2 sweat glands. It is the eccrine sweat gland that is primarily used for thermoregulation through evaporative cooling. Yes, we sweat under our arms and in the anal region, which are the apocrine sweat glands, but that's not going to help cool us down. Eccrine sweat glands. Know the abnormal spinal curvatures. We said that the lateral curvature is scoliosis. Remember, the kyphosis is abnormal curvature in the thoracic region, and that is hunchback. And then lordosis is abnormal curvature in the lumbar region, and that's your potbelly or pregnancy. Know the, and I pointed out to my other students, know the layers of the skin and thick and thin skin. If this is written, know the layers of the epidermis. If it's written, know the layers of the skin. By way of review, because there are going to be several questions, this is chapter 5, our first organ system, the integumentary system. We have 5 layers in the epidermis of thick skin and 4 layers in the epidermis of thin skin. Those 5 layers in thick skin are let's get sunburned. You're not going to tell me that. It's from top to bottom. Corneum, lucidum, granulosum, spinosum, basal. So if they write, police recall, Dr. Miller had defensive wounds where students were stabbing her in her hand because of that exam, which layers of the epidermis were penetrated, you're going to tell me. Corneum, lucidum, granulosum, spinosum, basal. But if Joe had a defensive wound and the knife penetrated his arm, which layers of the epidermis were penetrated, it would be 4 layers. Corneum, there is no lucidum. Corneum and thin skin. Corneum, granulosum, spinosum, basal. Now, those are the layers of the epidermis. And the epidermis is stratified squamous. Keratinized stratified squamous epithelial tissue. Then we have the dermis, which is connective tissue underneath. It's connecting the epidermis, epithelial tissue, to the adipose, hypodermis, and the hypodermis is just above the muscle. So in skin, there'll be a model on one of these exams. Name the layers of the skin. It's the epidermis with either 4 or 5 layers. Then it is the papillary layer of the dermis, loose areolar tissue. Then it is the reticular layer of the dermis, which is dense, irregular connective tissue. Then we have the hypodermis, adipose. So, know the layers of the skin and thick and thin skin. So that's really, and it should be the layers of the epidermis of the skin, and thick and thin, 5 versus 4. Know that the epiphyseal plate becomes an epiphyseal line after growth has ceased. So there'll probably be a problem that says either the person was still growing or they were not growing. If they're not growing, you would expect to see epiphyseal lines in their long bones. If they were growing, you see that epiphyseal plate, which is still hyaline cartilage. Up in the epiphysis or metaphysis, I think Pearson says epiphysis, and then you have the diaphysis where the growth of that long bone occurs. Know the category of fractures. If it is a child, you could potentially see a green stick fracture where the bone does not break all the way through. Some of my study aids, maybe some of your quizzes, talks about a stress fracture. Patient comes in complaining about pain in the leg. You do an x-ray, like the one I showed you yesterday, you don't see a break in the bone. However, you do see little tiny fissures throughout. Well, those are the stress fractures. And then my notes show you the spiral, the comminuted, which is splintered, and the depressed, hammer in the head, etc. No colles, which is a break in the ulna or in the radius or ulna. And it's when you put your hand out to break a fall. Then you have the POTS fracture. It is a common sports injury. POTS in the pedals, colles in the carpals, the wrist. Put your hand out to break the fall. The POTS pedals in your feet, and it is either the tibia, the big bone on the inside, the fibula, the bone on the lateral surface of the leg, or both. That's fractured. Understand how osteoclasts and osteoblasts work in opposition. First of all, you need to know they work in opposition. Osteoclasts are stimulated by parathyroid hormone, PTH. So PTH increases osteoclast activity and it will decrease osteoblast activity. Calcitonin increases osteoblast activity and decreases osteoclast activity. They work in opposition. But if the question on the exam says osteoclast, if it says PTH increases or decreases, in other words, if they're already in opposition, if you've got one part of that sentence says increase, the other part of that sentence says decrease, they're already in opposition. So stop, think about it, read the question, and I just gave you osteoclast, PTH, increase. Osteoblast, calcitonin, increase. And they work at PTH and calcitonin work in opposition of each other because you won't have clast and blast activity both increasing at the same time. One's going to increase by one of those hormones while the other one decreases. The other one will increase this one while it decreases that one. Questions, you got that?
Can you repeat that one? Sorry.
If I said that, I can't think of, because I got the question out of a TEAS test or one of the half-price books. But if the question says, what does PTH do? You're going to tell me it increases osteoclast activity and decreases osteoblast activity. If I ask you what calcitonin does, it increases osteoblast activity and decreases osteoclast activity. But if the question is written where one is increased and the other one is decreased, thanks, Lupita, then you have to read it carefully because now I already have them in opposition. We good?
Yes, ma'am.
Okay. Know the hormones, I just gave you those, that regulate osteoclasts and osteoblasts and how they work to maintain homeostasis. I'm glad I can't remember this question because I'd end up using it as an example. But again, you're looking for opposition and you're knowing which one affects clast activity and which one hormone affects blast activity. Know the sequential, and that's what this one is, your hormones. Know the sequential steps in repair of a bone fracture. We said you're going to get a hematoma. Then you get fibrocartilaginous callus. Then you get a bony callus, then bone. So remember the hematoma at the beginning and the bone at the end. It's these two steps that you'll need to put in sequential order. And the bony callus will be right before the bone. Know the bones in the axial and appendicular system. The question says, which of the following bones are or are not found in the axial or the appendicular system? So as long as you know the bones in your arms and your legs and their girdles, the pectoral girdle with the clavicle and scapula, and the pelvic girdle with the pelvis, all that's appendicular, so everything else is axial. So I think this is a multiple choice. Know the types of bone. We said long bones, fingers, other long bones. The bone is longer than it is wide. Short bones, they're wider than they are long, and they look more like cubes, and it's really your wrists, the carpals, and the tarsals, short bones. The irregular bones will be the pelvis, your vertebrae, the sesamoid bone is your kneecap. So I have irregular twice. So be able to apply the category to the bone in the body. So it's probably the vertebrae is an example of a what, and it would be irregular. Know the difference between true, false, and floating ribs. True ribs truly connect to the sternum. False ribs connect to the rib above it. And floating ribs do not connect to the sternum at all. We have 2 floating, 3 false, and the rest are true. Be able to differentiate between the categories of vertebrae. We have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar, 5 sacral, which are fused to give 1 sacrum in an adult. And the coccyx is 3 to 4 fused, so we have 1 coccyx. I will show you this on the lab exam because I think I do have a diagram, and you'll need to differentiate between these vertebrae. You'll need to be able to recognize them. Be able to describe a herniated disc. So a herniated disc, we have fibrocartilage between the vertebrae, because our vertebrae sit on top of each other, and fibrocartilage is a dense cartilage. So the fibrocartilage in the center where the compression occurs, where the vertebrae are sitting on top of each other, we call that the nucleus pulpus, that cartilage. And then we have a ring of fibrocartilage, annulus fibrosus, around the center of that fibrocartilage. If that annulus fibrosus, that ring of cartilage, does not keep the nucleus pulpus in check, it can push against the nerve and cause pain. And that's the herniated disc. Know which bone houses the pituitary gland. We learned that yesterday. It is the sphenoid bone and so a lot of the questions, some of the questions are 2-part. Know the bone. The bone that houses the pituitary is the sphenoid bone. What is the bone marking on this bone? And it is the sella turcica. The largest foramen in the body is the obturator foramen in the pelvis, the pelvic bone. And I will show you that when I go through the photomicrographs you may see on the lab exam. Know the 8 carpals, but I tried to narrow it down, recognizing that it's only 8 weeks, and with the final exam week and the holidays, and me hoping that these extra days for you to study make a difference, it's even less. So I am narrowing down these 8 carpals, which I trust and know and believe you'll learn in your professional schools, but you will at least know the 2 in line with the thumb, because we're going to talk about those when we discuss chapter 8. The two in line with the thumb, scaphoid and trapezium. Scaphoid is on the proximal row, trapezium is on the distal row. And I'll show you those for the lab exam. Know the type of burn category. For most ordinary sunburns, we can give a 2nd degree, Most ordinary sunburns are first degree, only the epidermis. Be able to describe and differentiate. So there must be another question regarding thick and thin skin. I've gone through that. Be able to describe and contrast each category of burn and explain why third degree burns require a skin graft. For the sake of simplicity, because I really said a first degree is the epidermis, the second degree is the epidermis and top layer of the derm. But anyway, for simplicity, I'm going to let you say first degree is the epidermis, second degree is the dermis, partial thickness, third degree is full thickness burn. It is the epidermis, the dermis, and the hypodermis. So now if I'm saying that's first, second, and third degree burns, if that third degree burns not only through the epidermis and the dermis, but even the adipose, the hypodermis, now I'm down to just muscle. So it requires a skin graft because we no longer have epithelial nor connective tissue. We're down to the muscle. So that's why it requires a skin graft. Know and be able to critically apply how nutrition and exercise affects our bodies. We said that Wolff's Law says bones remodel, which means they break down and build new bone cells based on demand. So if you have osteoporosis, yes, you should be exercising minimum 30 minutes a day. You don't have to go run a marathon. You don't have to walk a mile in 10 minutes. Just you're putting weight on the bones. Exercise is critical for maintaining bone density, good bone structure. The nutrition, we need a proper diet. We need calcium and phosphorus in order to produce the inorganic matrix of bone, which is hydroxyapatite. And in order for the calcium to be absorbed, we need vitamin D. Know and be able to list the bones in, this is another question in the, know and be able to list. So it sounds like it could be, excuse me, I'm so sorry. It sounds like it could be short answer. So the axial system, the cranium has 8 bones, the face has 14, the vertebrae has 7, 12, and 5, which is 24, 25 sacrum, 26 coccyx, and then the ribs we have 12, left and right, 24 total, but 12. 7 true, 3 false, 2 floating. The appendicular system, the upper limbs, the lower limbs, and the girdles. So the pectoral girdle is the clavicle and scapula, making up the pectoral girdle for the arms. The pelvic girdle is just the left and right pelvis bone, which attaches the legs to the axial skeleton. Know and be able to name the 4 cranial sutures and the bones they connect. So we learned only 4 of many. We talked about the coronal suture. And by the way, all 4 sutures connect with the parietal and some other bone. So you have the coronal suture connecting the frontal and parietal bones. You have the sagittal suture connecting the left and right parietal bones. You have the lambdoid suture connecting the occipital and parietal bones. And then you have the squamous suture connecting the temporal and parietal bones. Why is it important to properly place your hands while performing chest compression? Sounds like maybe a short answer, but we talked about bones continuing to ossify through life. So for some of our elderly, that xiphoid process can just break because it's brittle, continue to ossify. And if so, we could end up pushing it into the heart and the lungs, which are beneath the thoracic cavity. So that's why it's important to put your hand in the right place so that you don't break the xiphoid process and push it posteriorly into organs beneath, like the lung and heart. Know the name of the first So this is a three-part question. Know the name of the first and second cervical vertebrae, and be able to accurately describe unique features and what actions these features enable. The first cervical vertebrae is the AT, atlas. Its unique feature is no BODY, and it has smooth facets that sit up against the occipital condyles. And its action, those two small bones can now glide over each other as we nod for the yes movement. The axis, AXIS, is the second vertebrae, cervical vertebrae. Its unique feature is the dens, a knob-like projection sticking up. And that action, enabled by that unique feature, that dens allows cervical vertebrae number one to pivot on cervical vertebrae number two for the no movement. Know the three cell junctions and the function enabled by each junction. We said desmosomes hold those skin cells together. And in the osseous tissue, we talked about the canaliculi, which are gap junctions, allowing waste to be removed and nutrients to enter and reach those bone cells. So you have the gap junctions, desmosomes, and the tight junctions. We'll talk more about those when we get to the nervous system. Remember, they seal. I just talked about Wolff's Law. Bone remodeling is based on demand. If you use it, then you'll have old broken down and new bones made. How the secondary curvature, I'll have to rewrite my study guide, but know how the secondary curvature of the spine enables. We talked about, you saw the little baby with the C-spine, but if I turn it this way, well, when the baby learns to walk upright, the cervical vertebrae, that area caves in. Instead of convex, it's concave. And that's when we learn to hold our head up. And as soon as we get to the muscles, you'll learn that actually the nerves enabling the muscles in our arm to move are in that bottom cervical region. So it's when we learn to hold our head up. And then the secondary curvature in the spine, it goes from convex to concave. And in the lumbar region, that's when we learn to walk upright. So secondary curvature, cervical and lumbar region for holding our head up and walking upright. Know the three exocrine glands, their mode of secretion, and where they're located in the skin. The eccrine sweat gland is located in the dermis, and it goes to the surface for evaporative cooling. The apocrine sweat gland is also located in the dermis, but it puts its exudate in the hair follicle. The sebaceous oil glands are located around that hair follicle. Their mode of secretion is merocrine. Time out. Erase the tape. The eccrine sweat gland, their mode of secretion is merocrine. They marinate the surface, put fluid there for us evaporative cooling. The apocrine sweat glands are in the anal and axillary region because they put the sweat, the exudate, in the hair follicle. And that mode of secretion is apocrine, the apex ruptures. Our mammary glands also have a mode of apocrine secretion. And sebaceous oil glands are located around the hair follicle. Their mode of secretion is holocrine. They rupture, not just the apex like apocrine, the whole sac carrying the oil ruptures. And the last one is eccrine sweat, mammary. Oh, and oil. I've done all of them. You have the sweat, mammary, and oil. So we have merocrine sweat, apocrine, mammary, and apocrine sweat, and then sebaceous, holocrine. Know the definition of connective tissue and its unique features. Definition of connective tissue is cells plus ETM. The cells in bone or osteocytes, the cells in fat or adipose are adipocytes. Cells in connective tissue are fibrocytes with fibroblasts. The fibers. So we have cells, and then we have ECM, extracellular matrix. So osteocytes, adipocytes, other cells, because blood has lots of cells, and that is a unique liquid connective tissue. So we have cells, and then we have ECM, extracellular matrix. In the extracellular matrix, we have the fibers, and we have a liquid. So it could be proteoglycans or hyaluronic acid, or just the liquid component of blood. And then for the fibers, they can be elastic, reticular, collagen. It can be the fibrinogen in blood. So we have ECM. The definition of connective tissue is ECM, extracellular matrix, which is a ground substance and fibers, plus cells. Where do you find each type of cartilage in the body? Hyaline cartilage connects the ribs to the sternum. It's in the tip of the nose and the trachea. And at the end of long bones, you have fibrocartilage in the knee, in the pubic symphysis, between those two pelvic bones, and between the vertebrae. And then you have elastic cartilage in the ear and epiglottis. The inorganic matrix of bone is hydroxyapatite, calcium phosphate. The organic matrix of bone is that circle, and osteon, which is a unit of bone. Questions on the lecture exam? I see Gabby go no. Anybody else? No questions? Karen, you, no? No? We good? Okay. Here we go with the lab. Know and be able to name 5 layers. This was distinct. 5 layers of the epidermis in sequential order. So come, let's get sunburn. Corneum, lucidum, spine, granulosum. Come, let's get corneum, lucidum, granulosum, spinosum, bacille. Be able to differentiate between a male and female pelvis. I will have examples, and I'll give my student in my 8 o'clock class. I got a photo. She said that she was taught the female pelvis looks like a butterfly, but I always teach my students that pubic arch greater than 90 for women, or a U shape, and less than 90 for men, or a V or a U. Know and be able to list the bones. Again, this is now the lab, so it'll be asking you which bone is this in the axial, or is this bone in the appendicular system. Know the number of bones in the adult human body. On this exam, much like the one for lab exam 1, there were write-ins. So you're asked a question, you fill in the blank. It was name this tissue, it's going to be name this bone. And this sounds like a fill-in. Know the number, how many bones. It's either multiple choice or write it in, but I know you know 206. So know the number of bones, 206, and be able to recognize them in disarticulated fashion. I'm going to show you how to study for that. If I ask you for the scientific name of the elbow, it is the olecranon. Olecranon. When you're old, you kind of, no. Olecranon is the elbow. The number and name of bones in the phalanges. What am I asking? I want to see how ready y'all are. Know the number and names of the bones. I didn't mean to move that. Know the number and name of the bones in the phalanges. I'm going to take a pause and drink water while someone answer that, please.
Were the fingers and toes? So
Yes, Monica. Yes. So, and you're right, fingers and toes. If I said phalanges, that's fingers and toes. So now we've got the phalanges. So where's my, how many bones? Let's do fingers. You can see my fingers. How many bones are in the, what did the question say? How many bones? No, where is it? Oh, know the number and names of the bones in the phalanges. Here are my phalanges. Oh, wait, too many of y'all are talking.
Is it 3?
Okay, Gabby, is it 3 and all of them?
No, it's just 3 and the 4, and thumb is 2.
So now we've got the numbers. You're absolutely right. 3 in all of them except the thumb, and the thumb is 2. So great, you've got the number. Now name them.
Thumb is proximal and distal, and then
And the finger.
proximal, middle, distal.
You got it. You got it. You got it. Good, good. So
And
that's
this is Isabel. It's not whatever.
I'm sorry.
It's Isabel. Did you call me Gabby?
Why is Gabby on your screen?
I don't know.
remember I told you last time we had a Zoom, your name was Gabby.
Oh.
What happened?
We had a Zoom meeting like between us, and I kept calling her Gabby, and I was like, "Do you go by Gabby or?" And she
Yeah,
was like, "But Gabby's on her Zoom name. I don't think she changed."
is that someone else's computer?
No, this is mine, but I don't know. Maybe because Gabby's my sister's name, so I don't know if she messed with it.
She did. She did. How is that a younger sister?
Yes.
These young people. Spell it for me.
Isabel.
One L.
One
I was
L.
gonna make it Isabella. So
No,
got it.
no. I
I
get that.
changed, but I only changed it temporarily.
Okay, I'll fix it.
Okay. I'm trying to go back to my screen, but thank you. Y'all did good for that question. So here, the number and the name of the bones in the phalanges. No one be able to recognize the obturator or foramen. I have a photo for you. I'll show you in a minute. It's the largest foramen in the body. It's in the pelvis. Be able to differentiate and recognize each type of vertebrae. So I'm going to go through it. So whatever's on the exam, you won't confuse it. Most of my students confuse lumbar and thoracic. But I'll show you how to tell them. Recall the lumbar are the largest in size because they must be able to support the weight of the entire body when you were standing. But if I've only got one there, you don't have anything to compare it with. So I'll show you some unique features. Know and be able to recognize the name of the recognize and name the 4 sutures in the cranium. That same thing, lecture reinforces lab. So we have the same question on the lecture exam. Know simple versus stratified layers of cells and know which one is in the skin. I think I have some misses on lab exam 1. So here it is again. It is stratified layer of cells in the skin, and specifically it is keratinized, stratified squamous epithelium. Know the fibers in cartilage, in bone, in tendons, in ligaments, in skin, okay, that provide strength and resiliency. So that would be my collagen fibers. Collagen are the fibers. We can have collagenous. I don't think I mentioned that one when I said reticular, elastic, but we can also have collagen fibers. And those are the ones, by definition, that provide strength and resiliency to bone, skin, etc. The cells found in cartilage are chondriocytes. And that's why this is a hypochondric region, because it's below where the cartilage connects to the sternum. So hypochondriac for the chondriocytes, the cartilage. Know the cells in fat. And now that we've had A and P, we're going to call fat adipose. Therefore, and it does make up the hypodermis. So therefore, the cells in adipose would be adipocytes. This, with my 4 p.m. study group, I found that I reached back in the lab on epithelial tissue to pull this one. But again, we're talking about the skin, the body, but more specifically here, I'm talking about the respiratory system, the trachea, which is hyaline cartilage. And that is where we find for the tissue, pseudostratified ciliated columnar epithelium, moving back and forth to spread mucus so that as we inhale, if we accidentally inhale pollen or dirt particles, they don't go deep into our lungs. But with tobacco smoke, and I don't know how this question is phrased, I'll show you in the lab. With tobacco smoke, it shears off the cilia. So we don't have the mucus trapping things. So some things do get deep into our lungs. And therefore, for some, not all smokers, some smokers, you do have that hacking cough where they're trying to get something out of their lungs. The tissue that comprises tendons and ligaments, it is dense, regular connective tissue. In the second layer of the skin, the dermis, it is dense, irregular connective tissue. So the tissue that comprises tendons and ligaments is dense, regular. And then we have the dense, irregular in the second layer of the dermis. So I'm not sure what, know the tissue that comprises tendons and ligaments?
So it would be dense, regular, and irregular?
Thank you for the clarification. No, it would be dense, regular. Thanks for
Okay.
asking that. Thank you. It's dense, regular. I couldn't figure out what that may be getting to the fact that, oh no, that's the next question. Know that tendons and ligaments heal slowly. They actually become weak from inadequate repair after an injury, which is why they think whoever that ball player is, Aaron Rod, whoever, that broke his Torres Achilles, because now inadequate repair because of the poor blood supply where the ligaments and tendons attach to the bone. So this is a naturally weaker area of the body, prone to injury and slow healing. The bottom line is that the tendons and ligaments, unlike bone, they do not have a central artery and vein. Their blood supply, which brings in the nutrients, comes from the perichondrium, which wraps around it. So they heal slowly. Know that even a minor heart attack weakens the heart because the heart is unable to regenerate heart muscle, and thus cardiac muscle is replaced by fibrous connective tissue, scar tissue. Now, you can sometimes hear a parent or a grandparent come home and say, the doctor said I had a heart attack. And that's because they can see the weakening in the heart because that cardiac muscle is no longer muscle, it's connective tissue. Know and be able to apply physiological symptoms. So this is the lab. We already talked about this in the lab, first, second, and third degree, and you do skin grafts on third degree. Oh, but the physiological symptoms. First degree is red, second degree blisters, and for third degree, we really have tissue necrosis, tissue dies, and sometimes turns black. Be able to list and differentiate the 3 layers of lamellae and compact bone. This is right off of the lab. We did this lab 11. Remember, we had concentric lamellae around each unit. So this sounds like an essay, be able to list. Concentric lamellae around each unit of bone, which is an osteon, that circle. Then we had circumferential lamellae around the entire circumference of the bone, circumferential lamellae, concentric in a circle around each circle unit of bone, osteon. And then in between those circles is what's called interstitial lamellae, in between those circles. Know the skin model and be able to recognize and name. So the layers of the skin, the epidermis, dermis, and hypodermis, we've talked about that. The hypodermic layers where we give hypodermic injections, it's mostly adipose. The exocrine glands, the sebaceous are located around here. The sweat, you can see it go into the surface, and the apocrine goes into the hair follicle. So the skin model is going to be on the exam. Know the type of tissue that comprises the skin, and more specifically, the type of tissue that's predominantly in each layer of skin. So for the epidermis, it's keratinized, stratified squamous epithelium. For the papillary layer, remember it was the little part that pushes up. Here's the epidermis, and then the dermis, top layer, pushes up. So that's the papillary layer. It is loose areolar connective tissue. And then we have the reticular layer of the dermis, which is dense, irregular connective tissue. And then we have the hypodermis, which is mostly adipose. The epidermis is avascular and innervated. Avascular means if that paper, or if I have an injury that only cuts the epidermis, it's not going to bleed. It'll hurt, but it won't bleed. So if you have a patient that comes in with a cut and it is bleeding, you know that it penetrated through the epidermis to the dermis, because the dermis is where we have our blood vessels. Know the anatomy and physiology of the skin, and most specifically where to find thick and thin skin. Another repetition from the lecture review. On this one, I'm giving you as much as I can without giving you the question. We have 5 layers in the epidermis. It is the corneum, lucidum, granulosum, spinosum, bacille. And then we said we've got the dermis, which has the blood vessels. So when I talk live keratinocytes, first I already said that the cells are dendritic cells, kind of patrolling, the Merkel cells for light touch, melanocytes adding melanin, and keratinocytes adding keratin to prevent the skin from drying out. So if I'm saying the keratinocytes are the primary type of cell found in the epidermis, are they live keratinocytes throughout all layers of the epidermis?
No.
No. Which layers are not?
The top 2.
Thank you. The top 2. So the lucidum and the corneum are dead. They're not live keratinocytes. Also, if I'm talking about an injury to my hand, I got a cut, or I even form a callus, it's got to first start in the top layer, which is the cornea. So I'm happy to give the points back, but I'm also teaching critical thinking so that as you go out there for licensing, certification, other exams, but we'll see how you do with that one. I think in humans, they constitute 90% of the epidermal cells. So knowing that the top 2 are dead should help. And knowing that if something forms, it's got to first start in the top layer. Know the type of tissue in the epidermis and in the 2 layers of the dermis as well as the hypodermis. We just did that. Joints, we haven't even covered them. Here are the bones that you'll need to know. So let me show you some examples. Any questions?
No.
Thanks. Okay. And Grace asked, the most effective way to learn the bones is like I'm about to show you. It's what Grace asked. Here we go. I'm trying to, y'all can help me. I can't see the list of the bones that I said no. I tried to take a picture earlier. But you can help me if I don't show you, but what? Okay, here we go. So it said, oh, calcaneus. And yeah, lumbar and thoracic, Grace. Here we go. The oh, here it is. Okay. So on this one, if I said the first one is no, the calcaneus. So I would just type like I did here. I put calcaneus and I'm looking. Okay, and I could say name the bone in lavender. This is a view, this is a view. The calcaneus is the heel. It is going to be the furthest most bone away from that foot. Oops, I don't know what I did. So this one or this one, I could choose. And I usually look for it color coded. So I can say, here's one in yellow. Here's a different view, lateral and top down. So it's still the furthest one away. Name the bone in yellow. I would not do this to you. I would leave it in the foot, articulated in the foot. So those were a couple. It's going to be delineated. So I'll say name the bone in, oh, there it is. Name the bone in green. So I've showed you quite a few views of the calcaneus. Here is the image of the malleolus. This is perfect. If I could lift my foot up this high, this is what I would have done in class. I said that ankle bone. This is because this is his or her, digit 5. So this is the lateral malleolus. And I'll say, name the structure depicted with red, that the structure being shown in the photo below. And so this is the lateral malleolus. I didn't see any other ones. You see some fractures, but I didn't see any other pictures. Also, the negative here is every time I go out here is a different picture, which for you, every time you go to the internet, the search engine show you something different. But this is a great example of something I would use for the malleolus, lateral malleolus. I don't know where it went, but the one with the lady, I think I must have gone off that image. But the one with the lady holding, lady or guy, I think it was a lady holding it, but that was the malleolus. That was a good picture. I don't know where that one went, but y'all saw it. There it is. That's a good one. This one, bones of the foot. For the foot, no, would we get points taken off if we don't put lateral? If it's lateral or medial, there are 2 words to the answer. If it's the medial, it's going to be medial malleolus and lateral. I would probably give half credit if you just put malleolus, because that's good. On this one, this is a good one. I like this one. I think it was the talus and the calcaneus, because you also have to know the callus. I would say name the bone in yellow or name the bone in purple, if I wanted to get both from this diagram. This is a good one. I wouldn't give you the key. Could put a box over that. That's a good one. And it just depends. Oh, this is a good one. Nah, they're all blue there. But I would get one that's already color coded. This is a good one, yellow and light pink. Because I know we had I don't think I asked any of the other ones, the cuboid, navicular, or the cuneiforms. I just said talus and calcaneus. Frontal bone, perfect. Bam, there it is. Name the bone in green. I think it was temporal on there too. Oh. Name the bone in red. Red. I could pick any of these. Femur. Remember the Flintstone bone, definitive head. This is the femur. Y'all can see where my cursor is, right?
Yes.
Okay, yeah, thumbs up and Grace type yes, Richard. Okay, thank you. I had to. So here is this one. I could use this one. I could also use this one. That one has too much writing on it, but this is a good one with a black background, or this one for the femur. Here's the humerus. This is a good one. This is a good one. This is an even better one, showing you both. But this is the humerus. I usually try to get it so you can see the olecranon fossa. But this one is great. If I could just cut it like that. So this is the humerus. Know the humerus from, here's a good one. Now that one, it still doesn't confuse because there's a distinctive neck on that femur. So this is the humerus.
I think it would be a lot less painful if it's like connected to other bones or the body. Because it
When
by
you
itself
die,
is kind
Richard,
of,
the tendons don't hold everything together. And some of you are going to be pathologists. You're going to be the ones, body found on 410. It was unearthed, found the following bones, believed to be that of a male or female based on the pelvis. They are disarticulated. Except I'm cutting you some slack. I'm not going to take the frontal bone out of the cranium. I'm not going to take the zygomatic out of the face. I'm not going to take the calcaneus out of the foot. Some of the structures, and I'm showing you how they will be in place. So here is the tibia. It has a very wide top. This is the tibia. This is the tibia. Be able to recognize it. And that's, or I could use this one, very wide top. But this one doesn't go all the way down so you could see the malleolus. I could cut it off of this one with the fibula. But the first one, this one is good. Here is the fibula, a long, skinny bone. Fibula, stand alone on the exam, fibula. Here's a great one, not dark, but this is the fibula. And I know you've got the ulna, because I'm going to ask, well, I asked this distinctive bone marking, but I think because it's not a practical anymore, I think maybe I just asked for the anatomical name of the elbow. But this is the ulna, because there's the olecranon. This is the ulna. This is the ulna. Here's a great one. This is the ulna. So I put something like that on the exam. Here's the radius. And I said that distinct lip, which is the proximal or the head of the radius. So this is the radius, that distinct ring. This is the radius. This is a collar. I'm sorry, do not put collar on the exam. This is the clavicle. And it's kind of like, here's where it goes to the sternum. So this is the clavicle. This is the kneecap, the patella. I don't know if I use the area that goes against the femur and tibia, or if I use the actual kneecap that faces superiorly or outward. But that's the, yeah, this bone is the knee. I had one student 1 year put the apex of the patella bone, but this is the patella. I said, no, the 2 carpals in line with the thumb. This is perfect. I can say name the carpal, or I'm sorry, I would say name the bone in red, name the bone in pink. Trapezium on the distal row, scaphoid on the proximal row. This one is definitely showing you all 8 different colored. I like that better than all of them being the same color. But I could use that diagram or another one that has all 8 carpals, this one, but it's a different view. And here's your trapezium, because we said with the thumb, trapezium, scaphoid, but I think I like the other one better. I like this one better. Oh, the vertebrae. So for the vertebrae, if I put the lumbar on there, see, it's going to be hard for you when you can't tell them apart. So here's some differences. For the cervical, there are foramina, little holes here, so that as nerves come from the brain, they're going to go through those foramina in the cervical vertebrae so that they can be guided down through the rest of the body. So here are my foramina. And then this one is much wider, my lumbar. But you can't see the blunt spinous process at this angle. So I'd probably go more toward, this is perfect. Here is, you can't see the foramina. Well, you see that, that's my foramina. But here is the sharp spinous process. And then here are facets for where the ribs attach. Here is a blunt spinous process, and it looks more massive. So being able to tell the lumbar, if it's this view, lumbar, the blunt spinous process, I got it. Oh, thoracic, okay, it's got the sharp spinous process. And I see where the ribs attach. Oh, okay, that looks like a hole. That may be the foramina in the cervical. Or if it's this view, you could definitely tell the difference, a little wider, because it's carrying more weight, the weight of the body. Here's one, still looks a little bigger, a little wider. So, so I would have to come out here again. I'm not going to get color coded. You don't have to give me the bone marking. And that one has too much writing on it. But I would find one that had one of the vertebrae by themselves. I could go back to the one with 3, which showed the blunt spinous process, and actually just cut that one away from the other 2. Oh, I'll have the sacrum. The sacrum, you needed to know the sacrum. I just saw that. But you know, let's see, I thought I had the sacrum. And I will, if I use just one of those vertebrae, it will be distinctive. So here's the sacrum and coccyx. Perfect. There it is. And here's the coccyx right here below. So this part is the coccyx. This is the sacrum. Sacrum, and here's the coccyx. Those are generally both together. So here will be my coccyx starting here. This is my coccyx, and this is the sacrum. And I would find one that has, see if the coccyx is color coded. Yes, red, bam, there's the coccyx. Male and female. So remember the female greater than 90 degrees, and the male is less than 90 degrees. So here is a male. Anatomical differences. And here they are together, male and female, but they will be separate. So, and this is what one of my students told me earlier. Oh, obturator foramen, this red. So I would say name the structure outlined in red. This is the largest foramen in the body, the obturator foramen. Here's the hyoid bone. It will be disarticulated like this. So name this bone. I could get any one of the views, this one or that one, but it would be the hyoid. Here's my temporal, parietal, knowing those bones. Again, for the cranium, they will be in place. For the facial, they will also be in place. Yeah, I think I was trying to find the palatine. And here's what my student told me with, sorry, I forgot to plug in my Mac. This is what my student told me with the butterfly. The female pelvis looks like a butterfly, is what she was taught. But male pelvis, you can see less than 90 in that one. If I put the female on there, it's going to be wider. I say a V versus a U. And there it is. It's much wider. How much did we go through? Did we go through clavicle, coccyx? Oh, ethmoid. Darn. I did fibula, frontal, humerus, hyoid. The facial bones. So review those. I've got diagrams in my notes, in my lecture slides. Nasal bone. These are the facial bones. There could also be a question that says, name the 14 facial bones. Or, I'm sorry, name how many bones are in the face, name them. How many bones are in the cranium, name them. We went through true, false, floating, scaphoid, sternum. So the only thing I probably need to show you is the sternum. And which other one was I going to show you? Don't forget the mastoid process and the styloid process. So the mastoid process. Green, that's perfect. Mastoid process. Styloid process. Red, that one's good. And then I forgot what other one I was going to show you. I think that's it. Any questions? Anything else you want me to show you? I think you got the gist of how to study for it. Questions?
I do have a quick question. Are we going to have to name the bones, like the medullary cavity, the epiceleal plate, compact bone?
Say that again?
Are we gonna label the bone, like the inside of the bone?
Oh, no, the medullary cavity, the spongy bone, compact bone, nope.
Okay, thank you.
You're welcome. Other questions? Okay, good luck. Don't miss the exam. Good luck. I know y'all will do good. If you have any questions, send me an email or text me.
I have a quick question really quick.
Okay.
So for the interview thing, like I